would you rate the recognition of mental health in the agriculture sector?
From where I see it in terms of the programs that I have been party to and seen implemented across the sector, I'd probably give it a very low rating, maybe way below 5.
Okay, I would also concur with Dr. Sieka, especially putting it 4/10.
Why would you give it that figure?
When we look at, be it digital interventions or be it other interventions to improve market access, climate resilience, etc., very few of them are framed with the perspective of looking at mental health or well-being of the farmer. In general, they look at economic well-being, but not mental well-being. So I think there's a huge gap that needs to be considered and worked on.
Currently, there's some bit of awareness around mental health and how it impacts a lot of other sectors. But when we look at policy, we look at practice, we look at the professionals in the agriculture sector, the intermediaries, and even the farmers themselves, bringing in the services around mental health in climate and on their daily basis, it is not well sounded. Besides, we know mental health has a lot of stigma and a lot of lack of awareness. Not many people are really thinking about mental health. It's oftentimes mistaken for the physical illnesses because, of course, physical illnesses will mimic will mimic mental health to some extent, and therefore there is limited knowledge. There's limited interventions being put in place. There's limited targeted approaches towards integrating mental health in climate, in agriculture.
Maybe to add, Dr. Pam, beyond just the mimicking of physical illness, there's also the cultural nuances around mental health and what different cultures subscribe to abnormal behavior, which again complicates the whole issue, whereas it could be something that just stress, depression, etc. Some cultural nuances around such behaviors can be negative.
Mental health is not something that's discussed, especially in Africa. So I'm curious to know, let's even just talk about not even the urban setup, but even the rural setup. You could give, just let me know, do farmers consider mental health important? And what mental health challenges, even in your work, have you observed?
I'd say yes, there is noticing of mental health issues, but unfortunately, even as Dr. Sieka says, they are not sounded as mental health. You'll hear somebody saying, I'm emotionally distressed, I'm hopeless, I am not sleeping well, I am becoming irritable. For them, that one, much as they are pointing out the indicators, they are not actually speaking about mental health. Unknowingly, that is exactly what they are saying. They will say, oh, there's a lot of pressure, fertilizer has become very expensive, now I am not able to go to the market. All these things show frustration. So from a psychologist perspective, I can pick the mental health perspective. But from them, what they are seeing are all these challenges that they are experiencing, you see. So yes, they are talking about it, but then it's not clear. It is really actually mental health, unless a professional comes in and unpacks it for them. What are the issues that we are observing? Stress and anxiety, because of the unpredictable patterns. As the patterns get unpredictable, as people start getting to lose their livelihoods, there's a lot of anxiety and stress. There's also hopelessness that is a pointer of depression, though not noise as such. Psychological distress is manifest. Some people are actually trying to cope with these challenges through substance use. So you see increase of substance use disorders as well. Burnout, family dysfunctionalities to some extent, which I have also observed in research, suicidality. People lose hope to an extent that people are going to the extent of being suicidal. This I observed in my research around the nexus between climate change, food insecurity, and mental health in sub-Saharan Africa, where we had incidences of farmers who actually died by suicide, you know. So this is how it is panning out. But then we need to really put a lot of effort in bringing communities this conversation to be integrated in whatever is being done in every sector.
Wow, very interesting insights there you've shared. I think mental health even being discussed, I mean, suicide, that is very scary. I think it's a reality that we live in because sometimes mental health is not discussed in communities. Sieka, maybe I can throw you a spanner in the works. Even with mental health not being discussed, even your experience even at AgriFin, is this something that AgriFin has been able to look at? Because we push technology, we push fintech products, and we never really ask the farmers, like, what's going on through your mind, even as Dr. Pam gets settled.
And that's the crux of the matter. It's not built into our current thinking around how we focus on economic development. We do take into consideration when we are sometimes designing products. So we will ask how this product will impact their livelihoods. And in some way, we touch the topic of their well-being, but not in a way that clearly states and supports the farmers to really think through the mental distortions and challenges that they could potentially be they could potentially be facing. To put a bit of history in this, one of the challenges we're doing is we're actually doing a cultural revolution. Yeah, putting in my sociologist and economist hat on. When we talk about agriculture and agribusiness, as we are focusing on transforming the way farmers work to focus on profitable enterprises, we're not only shifting the economics, we're also shifting the cultural fabric that was built around the practice of agriculture. So there was a social activity where there were current safeguards. There were certain safeguards around whether you couldn't harvest. There was a lot of sharing within the community, Ubuntu. There was a lot of psychological support amongst peers in the traditional sense of agriculture. As we've moved forward to commercialize it further and to extent making farmers work as independent units, that social framework and fabric has decreased significantly, leaving the farmers open to all the challenges, as Dr. Pam mentioned, anxiety, distress, and a lot of psychological disturbance, potentially in some cases leading to suicidal attempts, ideations, as well as substance abuse. So there are those changes that have affected the system, and as the development actors, we have not done enough to really focus on that space. And I think it needs to become part and parcel of all the programming that we do, a small portion of it. And of course, programming is also followed by where donors fund. And so in the donor agendas as well, it needs to be a key part of the conversation. We're not only just looking at economic resilience, but we're also looking at mental well-being. We're not only looking at health outcomes in terms of nutrition, but also the well-being of these individuals who are supposed to be working on the land to deliver economic outcomes.
The fact that mental health is not talked about, let's even just give an example of a community, maybe in a rural farm in Embu, right? Like we've said that we need to consider it in the programming, but on the other side of the farmer, it's not something that is encouraged. In fact, if you talk about mental health issues, it's considered a taboo, and you're considered something is wrong with you. Maybe Dr. Pam, you could speak to this. How can we go about that? Even as the development actors, we're trying to see, oh yes, let's provide more intentionality towards this. But on the side of which behavior change needs to happen so that they can be able to speak about it.
I like to tie this with what Dr. Sieka has said, that really we have to be very intentional. You have brought an example of a local farmer, an entrepreneur in a county. What do they need to do to be able to be comfortable with this. We know everything that people don't have a lot of information around. There's always around a mystery, and it causes people to say, this one we are not discussing. And that is the same thing with mental health. It is tied to witchcraft. It is tied to an evil somebody did. You know, you did the evil to somebody, so this is payment. There is witchcraft. This family has been bewitched. So the lack of knowledge about mental health is the gap that we need to really address so that we can create awareness. Having infrastructure at the local level that is responsive to mental health. You remember the time HIV was, the prevalence was quite high. Government made it a multi-sectorial approach. So everybody got to understand HIV at the lowest level. This is my prayer at one point, we will be able to see experts in mental health, counselors, psychologists, being deployed to the lowest level of the health facilities, so that as people come for treatment, before even they see a doctor, or when they see the doctor could be able to tell, can I hear the perspective of the psychologist? Can you go see the psychologist first, so that now we can continue with this treatment? Because if you remember the study that was done in Kenya in 2019, it revealed that 25% of our outpatients in Kenya today have a mental health condition that has not been diagnosed. So they are going to the facility to be treated for muscle pain, backache, headache, diarrhea, and all these things. But behind them is a psychological issue. 45% of our inpatients have mental health conditions that are not diagnosed. So they are on treatment and occupying the hospitals for the wrong reason. And you see, as long as that is not being treated, the burden of disease continues to increase for the family, for the country, for the county. So my prayer is that we can do a lot of awareness around mental health. If we can be able to have the mental health, the health champions that were employed to be built capacity a bit to be able to detect and then refer, that will be a very good starting point, so that it will help conversations around mental health to be normalized. When people are in the market there and somebody is feeling somehow, they can tell the other person, hey, the way I'm feeling today, I think I need to go and see a psychologist. It's not that I have malaria. It's not that my stomach is, I think I need to go and see a psychologist. So if we can normalize discussions in the agricultural sector around mental health, what does it mean when a farmer loses an entire crop? What does it mean when a business person has bought tomatoes and they are taking them to the market, but it rains, so the entire lot is destroyed before it gets to the market? And imagine they have been advised to take a loan so that they can start a business. Now they have the loan, the business has collapsed. This person requires psychological support. We need to get to that level.
Thanks, Dr. Pam. And just a quick one, even before I go to Sieka. I want to ask, is there a difference with how women and men, like men, smallholder farmers, take up, especially when they're being told, have you gone to a doctor, a psychologist? Is there a difference in how their behavior is? What have you noted?
Is there a difference between men and women? Yes. You know, there's a gender perspective to mental health issues when it comes, especially in prevention and management. We know the behavior of our men to seek health facilities is usually very low, even for physical illnesses. So they will definitely have a delayed detection. We know with women, they talk a lot, they verbalize a lot. Amongst the chamas, with their fellow women, they will talk about the loss. They will talk how they have not paid the loan. You know, because of that discussing, at times it reduces the tension in them and opens them up even to kind of reflect and the kind of help themselves to cope with the losses. But for the men, they are more less talkative. They'll look at things from a perspective of cognitive. They think a lot than feel. So the women will feel and therefore will likely act faster. The men will be thinking about it and quietly think of solutions without thinking who can help them. So there's a difference. Besides, when you look at men, they are the landowners. They are the ones who decide what will be planted at times. They are the ones who decide the market. So they carry the biggest burden in investments, unlike the women in terms of agriculture. So the losses are higher on them, and they are dependent so much on to take care of the family. So they have a bigger burden. Of course, women will say in the mineral enterprises, because they are the ones in the market, they can change from one market idea to another. So it gets a bit better for them. But definitely speaking, the impacts are gendered, but we also need to have a gendered approach to the interventions.
Dr. as you're speaking, I'm also, my mind is also reflecting on how we think about one of the key variables in credit scoring to give loans, which is willingness to repay. And again, that is very gendered. We find that willingness to repay is much higher in women than it is in men. And this is a very psychological thing. Being willing to repay a loan really depends on your psychological framework. And women tend to, even though they delay on a loan, that willingness is there. We found from our research that even if when women are late in paying their loans, they eventually pay afterwards. They make that effort, but men would then default on that loan in general. So statistics are actually showing that, yes, there is a lot of gendered nuances when it comes to this psychological phenomenon.
And especially, of course, looking at gender, not only about male and female, but also the age and the other stratas. With the youth, they are faster to take risks. And when something collapses, it collapses very badly for them because they took at times uncalculated risks. The youth. When it comes to the elderly people, you can imagine the vulnerability. An old person has taken a loan because they have been told that fertilizer is available to plant this. So they will take a loan, buy the fertilizer without considering the climate aspects. So when there is a loss, the elderly person is more vulnerable. They even have other chronic illnesses that come with age. So you can imagine mental health now also coming into play, the situation of that person. So the gender aspect plays a lot.
So, Sieka, you talked about that we should have this possibly even in the development world when we're creating programs. Do you think it should be a part of impact when we're measuring impact or outcomes? And just to understand, do you think it should be something? Do you think it's something we can work towards? And how else can we better support smallholder farmers?
Yes, to the extent that mental illness is a very individual thing, but as we incorporate it into our programming work, definitely additional research, and which will include research on impacts of different interventions to support the livelihoods of smallholder farmers should be done, should be incorporated in our logical frameworks, in our theories of change, and this can really support a larger body of evidence that will really improve, as Dr. Pam was mentioning, the extension and expansion of psychological support services deep into rural locations. I think it will also help in terms of customizing, tailoring some of this counseling and psychological approaches to meet the needs of the rural person, so that it takes care of cultural nuances and the way communication needs to be transferred, so that it's easier to be adopted by those particular populations. So definitely, yes, it should be part and parcel of all programming work.
Just maybe to hand on the same,
yes,
it is very important because if something is not integrated into the programs, then it will not be funded. That is how to channel resources. Because if we can be able to point out to it then resources will be channeled towards interventions. Resources not only monetary, but even capacity for the responders. Yeah.
Now, my last question, are there any tools and facilities available that you can recommend being used by farmers and players in the industry, not necessarily in the African ecosystem, but also in the European and Silicon Valley, that's America and the other countries? Is there one that you've seen that's worked towards improving mental health? And what role can digital innovation play? That's to you and Sieka. Dr. Pam, maybe you could start off.
Okay, I want to say that this is a new space, especially in the African context. And with it being very new, much as we have online applications that people can use, I wouldn't recommend physical interventions where we have counselors and psychologists available to help our people. Because unfortunately for the applications, the application may tell you what to do or kind of use it to self-diagnose, but then you will not get the right support. So especially at the beginning, now where we are in Africa, we need to really enhance the foot soldiers so that people can be supported, so that they can be helped to cope. There could be applications. I need to point to the fact that we have counselors and psychologists networks that we can depend on in Kenya. In Kenya, we are privileged that now we have the counselors and the psychologist board that is regulating the counselors and psychologists in the country. I represent, as the president for Kenya, International Society of Substance Use Prevention Professionals, which is a network of counselors and psychologists who are in the space of harm reduction. So these are the networks that we need to leverage on so that we can use what is locally available to help our people appreciate and help our people be able to manage the challenges that we are faced with. Thank you.
I think Dr. has covered it very well. Just to add one more perspective, in other spheres of digital, we've recognized that trust is a key component for adoption of digital solutions. And trust is also a very important aspect in terms of counseling psychology. If you're going to work with individuals and you're going to try and use digital interventions, then you must bridge that gap of trust. So as Dr. is mentioning, due to the low levels of trust in digital interventions that come with their own frictions like fraud, being taken advantage of, etc., it might not be the best place to start. As Dr. is mentioning, let's start with physical interventions, get the population to understand, build trust in actually how psychology can support their better livelihoods. Then you can then deploy, there are myriad of alternative ways to actually then have this conversation sessions over digital interfaces that increase the reach that psychologists have with their clients. So definitely starting off with the various institutes that Dr. has mentioned, the various associations that are across the country. And you'd be surprised that there is availability, even in Embu, in Meru, etc. There is availability of counseling services. It's just that awareness that needs to grow so that individuals can then take advantage of these services that's highly relevant for mental health.
Wow, thank you very much, Sieka and Dr. Pam, for those insights. We really appreciate you just participating in this discussion. It's a needed discussion today, and more than ever because of all the societal, financial pressures, the shifting landscape of funding. There's a lot that's going on, climate change. So, Dr. Pam, you want to say something?
I just wanted to say maybe we can, working together, craft a curriculum on integrating mental health in agriculture, or together we need to be able to have a curriculum that can be run in the region, especially so that we can create awareness and build the necessary capacity. And I'm sure with Daktari and yourself, this will be something that will help our region better. Thank you.
Yes, we should follow up that conversation, Dr. Pam. So yeah, I will look for you.